Hi, my name is Jamie. I'm going to be your nurse today. Can you state your first name?
Nick,
Hi, Nick, and how old are you?
22.
Excellent. I have you in for a respiratory assessment. I'm going to do a lot of tapping and listening to your lungs. It doesn't mean that there's anything wrong. I just want to make sure that I do an appropriate and excellent respiratory assessment, okay? Do you have any questions before I get started?
No.
Excellent. Okay. So I'm going to begin by looking at your chest to make sure that there's no rounding. You have good posture, and it looks good. Okay, so can you turn to the side for me? All right, this is your anterior, this is your posterior, and it is transverse. It is 1 to 2, which is appropriate. I'm going to need you to turn around, and I'm going to verify that one more time. Okay, so this is your anterior, your posterior, and it is transverse. The next thing I'm going to do is I'm going to look at your scapula and your spine to make sure that it is in alignment, which it is. And then after that, I'm going to do a tenderness exam, okay? So I'm going to place my hands on your back like this, and I'm going to go down and across your lung fields, and I want you to tell me if it's tender, okay? Tenderness here?
No.
Here?
No.
Here?
No.
Here?
No.
Here?
No.
Excellent. So now I'm going to do a tactile thermitis, which allows me to hear for vibrations. I'm going to have you say 99 each time I touch your back, okay?
99. 99. 99. 99.
Excellent. Okay, so now I need you to exhale all of your breath. All right, now inhale for me. Excellent. You have great symmetrical expansion. All right, so now I'm going to be doing some tapping on your lungs. Excellent. So now I'm going to do the same thing again, but I'm going to listen with my stethoscope. I'm going to have you shrug your shoulders forward. And I'm going to have you take a few deep breaths each time I touch your back, okay? I'm going to go all the way down your lung fields, make sure you have good airflow, and listen for resonance, okay? Excellent. So now I need you to turn around. I'm going to do the same assessment that I did on the back, but on the front. I'm going to begin by looking at your chest to make sure you're breathing appropriately and it's non-labored without the use of accessory muscles, which it is. Okay, so I'm going to do the tenderness exam. So I'm going to put my hands here and tell me if it's tender, okay? Here?
No.
Here?
No.
Here?
No.
Excellent. Now I'm going to do the 99. So again, I need you to say 99.
99. 99. 99. 99.
Excellent. Now I'm going to do some more tapping. Excellent. Now I'm going to listen to the same points with my stethoscope. Take a few deep breaths each time I place the stethoscope. Excellent. Alrighty, well that concludes my respiratory assessment. Thank you.
Thank you.
I have a 22-year-old male patient who came in for a respiratory assessment. I started off by looking at the shape and the configuration of his chest. His chest was nice and straight with good alignment, and it was appropriate. He had no rounding. His AP to T diameter was 1 to 2. His spine and his scapula was within midline. Upon inspection, he had a respiratory rate of 16 that was non-labored without the use of accessory muscles. He had his anterior and posterior vibrations were heard upon tactile thermitis. He had anterior and posterior tenderness was negative upon palpation. He had great symmetrical expansion. That means that his lung fields and his lungs were bilateral and rised equally. He had all of his lungs were clear upon auscultation, and his lungs were clear upon auscultation as stated, and then finally his resonance were heard upon percussion anterior and posterior. That concludes my respiratory assessment. Thank you.